You can maybe start by giving your name, job title.
My name's James McDiarmid. I'm a plastic surgeon. I am the owner and founder of Wood Medispa. We're a surgery centre. We do mostly aesthetic plastic surgery, but we also have some other specialties. We do dentistry, ophthalmic surgery, dermatology, and hernia surgery. And we've been running for just under 3 years. Being here has enabled me to develop my practice and to invest in technologies and treatments that were previously out of my reach. And that's one of the reasons why we started to consider fat banking as an option for some of our reconstructive and aesthetic patients. I've been a doctor for over 30 years now, and plastic surgeon for almost 25. One of my fellows, who is an excellent plastic surgeon, worked here with us for several months last year, made the introduction to tissue and cell. He'd previously been in Sheffield, where you're based, and we built a relationship from there, and eventually we've done a few cases. And the particular case today is a gentleman who I think is a great example of what's possible to achieve with stored fat. So I met Ryan a couple of years ago. He'd been in an accident. One of his legs, he'd lost quite a lot of muscle bulk, and he had quite a bit of soft tissue scarring. And we discussed options for reconstructing the volume in his calf. He's a very outgoing and very sort of confident person, but even with his sort of innate confidence, he was still reluctant to wear shorts. And it was we decided to take a 2-stage approach to reconstructing his leg. The first thing we did was to insert a calf implant under the fascia of his leg to reconstruct what's called the medial head of gastrocnemius, which is the bulkier side of the calf muscle. And once that was in, that got him quite a lot of the way towards symmetry. In order to finesse that result and to fill out areas that you can't correct with a calf implant, we decided that harvesting fat with liposuction and having several sessions of fat injection would give him the best opportunity to get the best symmetry he possibly could. And that's what we did. He had a liposuction, and we stored, I think it was, we harvested about 1 litre of fat, some of it with Vaser and some of it with micro-air liposuction. And interestingly, that as a short aside, Tissue and Cell looked at the viability of the Vaser fat versus the micro-air harvested fat, and they were very, very similar. So we put some fat in at the time, and then Ryan came back on 2 further occasions and had fat injected. And it just meant that he had 1 harvesting session and a total of 3 volumization sessions. And that's really important because you can only put so much fat in one go. So if you think about the fat that we put in, a third, if you put it all in at the same time, you wouldn't get anything like the percentage survival. So we put 1 amount of fat in, as much as we thought his tissues could take. We let everything settle down. You lose approximately 50% of the transferred fat in these cases. And then we went with another session and allowed some more settling time, and then used the final part. And at the same time released some of the deep scarring. And we managed to achieve what Ryan feels is a really excellent correction. And I think it's fair to say that he's quite happy to wear his shorts now. The fat banking service was very straightforward. It was very well organized. All of the consumables that we needed to store the fat were available to us. The collection and delivery were prompt and well organized. There were no hitches with it. The fat is inspected to ensure that the tissue is viable, and also that there's no contamination. and it's a very professionally ran, well-led service with excellent supervision from the tissue and cell team.